Okay. All right, so I think I know most of you, but my name is Jenny Borda. You could call me Dr. Jenny Borda. I have my doctorate in physical therapy. You know what? Let's get off Andy's slides. We're done looking at those. All right, so a little bit about me. I grew up in Ohio, not New Jersey, in Dayton. Does anyone know where Dayton is? Yep, kind of toward Indiana. So I grew up there. I came to Columbus because I was on Ohio State's gymnastics team. I stayed on only for a little bit of time. I had some injuries, some just things that didn't mesh. I wasn't very happy on the team there. Ended up stopping doing gymnastics, started coaching gymnastics. Coached gymnastics for a long time. While I was coaching, graduated college, went to physical therapy school. Then I got my job at Children's. So has anyone ever gone to Children's to see a doctor, gone to therapy there? So I worked at Children's for 12 years. I've done sports rehab for athletes for over 16 years now. Crazy, because that means I started when I was like your age, right? I guess not. They're like, no, lady. So I've worked with athletes for a really long time. I was an athlete for a really long time competitively. Once I stopped coaching gymnastics, I started competing in CrossFit. That's what brought me here to Friendship. I came here because I wanted to get back to being competitive at something. I was competing in CrossFit. I competed pretty successfully at Olympic weightlifting. And then I had a big injury. So this is my shoulder now. I have a little fake piece in my shoulder. So I had this giant injury that made it where I couldn't really compete at a high level anymore. And so then I really turned my focus onto how I could do more of what I liked doing with athletes. Because at Children's, I only helped people that were hurt, and it wasn't a very sustainable relationship. They came for this short little bit of time, and I had a whole bunch of rules of what I could do with them. And so I decided to leave and start my business here at Friendship, which is called Built by Borda, where I work with mostly youth athletes, some adults. I've seen some of these adults in here too. But I work with athletes in general to help, one, get them back when they've been hurt, but also keep their bodies nice and healthy. I have a little girl. Her name is Vivian, some pets, and we're gonna talk a lot about injuries in sports today. Sound good? All right. So first, just a little intro. None of these are, I just wanna get like a little bit of an idea of how common things are. So you can see 3.5 million injuries in youth athletes, so 5 to 18 every year, with 1 million of those being emergency room visits. So extremely common, probably too common. I think when you do sports, yes, things will hurt sometimes. You run that risk of getting hurt. You run that risk of getting hurt doing all kinds of things, right? I would say sitting on the couch for your whole life is every bit probably more dangerous than going out and playing sports. But there are some things we really want to keep in mind. It matters because injuries really do. They matter for your mental health. They matter for long-term success. If you're injured all the time, there's zero chance that you're going to be as successful as you would be if you had a nice, healthy body. And it really helps build who you are as a person, right? If you're hurt all the time, are you going to want to keep working hard to play a sport, things like that. So how healthy you can keep your body is extremely important for success and how far you're going to go in the sport of your choosing, okay? And I know we have a bunch of different sports here. What kind of sports do you guys play? Why don't you tell me? Yell it out. Jiu-jitsu, diver, soccer, gymnastics, baseball, football, wrestling, track, not flag football. Nice. Look at all of these different athletes. So here, that's my ankle, guys. That was my ankle. Ugh. Right? So I've had a good handful of injuries. So anyway, you can kind of see, I'm not going to break it down like, oh, this sport is exactly this. But this gives a little bit of an idea of some common sports. So basketball, a ton of knee and ankle injuries. Ankle sprains are extremely common. And you know, if you sprain your ankle, you're way more likely to sprain it again if you don't rehab it properly. So there's a lot of things that injuries continue with people because they aren't knowledgeable on how to make them better, or they aren't willing to work on making them better. But then that is kind of setting you up for consistent issues. So talk about soccer. We have some ladies in here. Any of the girls in here play soccer? Yeah, so girls are 4 to 8 times more likely to tear their ACL than boys. And that's a little bit of how we're built. It's a little bit of just how our anatomy is. But it's a combination of our anatomy based on also how strong we are in certain areas. Okay, at the very end of this today, we're gonna go over areas that athletes, especially youth athletes, typically have weakness, and we're gonna come up with some exercises to work on those commonly weak areas. We have gymnastics. So 85% of gymnasts will experience back pain. That's a really high number. It's something that if you follow me on social, I talk about all the time. I saw 4 people today and 3 of them were backs. Adults also extremely common. And I think backs is one of the ones that's just really common to be like, oh, well, yeah, my back hurts, right? Oh, I do this, I'm active, so my back hurts. Or, oh, I deadlifted, so my back hurts. But like, really, one, when you're a kid, your back shouldn't hurt. And when you're an adult, your back shouldn't hurt all the time. That just isn't normal. Consistent pain isn't really something you should just be used to. It's something you should consistently be working on. And then football, that's a big one with concussions, probably way more than other sports, knee injuries. And I'll also say back problems are big in football, especially if you play on the line. So other sports, I know we named a whole bunch of sports out here. We could like look up all the results of what the most common injuries are, but more than likely you're gonna hit ankle, knee, shoulder, back. Those are gonna be the big ones. There's some other ones that will be fairly common, but I would say those are the big ones for the sports that we have in here. So growth plate injuries, that is not something we have to worry about as adults. This is something that we do need to worry about in youth athletes because who knows what a growth plate is? You don't get to answer if you're an adult. Does anyone know what a growth plate is? All right, so it's a part of your bone. This is a great example of a growth plate right here. So this is my thigh bone. It's called my femur, and this is the bottom of it. And do you see this line here? You might be like, oh, is that broken? It's not broken. That's where this person's gonna grow. So that's where your body lays down more bone for you to get taller and taller. And all of your bones have them because that's how they get bigger. So a growth plate injury, has anyone in here ever had like Osgood-Slaughter in their knee? Yep. Or Sever's disease, or Syndergaard-Johansson at their knee, or Little League elbow, right? So there's all these different things that Little League elbow isn't named after anyone, but all of these are the doctors who discovered them. That's why they have really funky names. It's like these doctors discovered this issue and they named it after themselves. So you also can have a Salter-Harris fracture, which is a fracture, but in a growth plate, which matters because if it's bad enough and it doesn't heal, you're not going to continue to grow appropriately. So extremely important to appropriately take care of issues in growing athletes because you can have issues that don't exist in the adult population. Also important, in my opinion, to have them addressed by someone who sees a lot of imaging from kids also. If you go always to an adult doctor, I have seen people be diagnosed with fractures or things like that that's really just a growth plate. So things to think about is who am I going to look at these things because a child's x-ray does not look like an adult's x-ray. So those are kind of common growth plate injuries. You can have growth plate injuries just from growing, right? If you grow really quickly, you can have problems with that. Typically the issue is, so this is an Osgood-Slaughter, okay? This is a really bad one. This person does not feel good. So their muscles right here, who knows what this muscle is called? Anyone? Your quads, yep. So my quads come down, they come around my kneecap, and they attach right here on this little nubbin. And if you have Osgood-Slaughter or had Osgood-Slaughter, you got a big nubbin usually, right? Why? Because what happens is my quad, that tendon, which is a tendon connects muscle to bone, is attached right here at this growth plate, and it's pulling on it. So it's pulling the growth plate open, and then what happens is more bone grows in that place. So then we have, I like to call it a nubbin. You're not going to find that in an anatomy book, okay? But that's why that happens. And that can happen all kinds of places, right? If I throw a bunch, like I'm a baseball pitcher, it can happen at my elbow. It happens a lot of times at people's heels, right at their heel bone, because their Achilles pulls on it. And sometimes we can't completely control it, but a lot of those things happen because we're too tight or we're not strong enough or we're just doing too much on it. Because really, you need adequate rest and adequate strength if you're going to be doing a lot of sport activity. And it's really common, especially now, for people to specialize in one sport, which means they really only focus on one thing a lot. And there's this rule that it's like up till 12 years old or something. And this is not possible with some sports. But there is a lot of research that goes into you shouldn't really practice more hours a week than you are years old. And so that does get hard with some sports, but there's a component of that. If you're 8 and you're practicing 20 hours a week, you're likely gonna see more negative physical consequences of that, okay?
Total for all your sports.
That is total for all your sports, yes. Yeah, so if you play multiple things and you're seeing all of these hours add up. So having rest periods, taking breaks, things like that are extremely important because your body needs to grow appropriately and not have bones falling off. So different for everyone. I would say, for girls, it's earlier than boys. I mean, boys' growth plates can stay up until they're 22. Like there are definitely guys that can grow a lot longer. Some girls, their growth plates will close at like 11, but some might be 13, 14, 15. Honestly, back to kind of what Andy was talking about, you will see later, especially in girls, later growth plate closure with poor nutrition also. So an important piece of that, for girls especially, some of it is, you have to look at, guys too, but you just have to look at like the start of puberty. But for girls, that's easy because you talk about a period. And if you don't have enough nutrition, then your body isn't gonna respond how it's supposed to at those ages. So there's some signs that you can look for if you're tracking. And it's also, you go to the pediatrician and you have your growth curve. So one thing you can also look at, which lends a lot to nutrition, but also could be overactivity, is, I'm following this curve and I follow it really nicely, and then suddenly I have this where I dip to another curve, and that's problematic because you shouldn't really leave your growth curve too much. So,
are these growth plate injuries treatable?
For sure, yeah. I think, we'll get into some of that, but very much. So for a lot of people, there does have to be a little activity modification. But, I had a gymnast once that when I was coaching, so I was not a PT yet, who took medicine. She had Osgood-Slaughter and just kept taking medicine and really didn't appropriately treat it, because a lot of times people are like, it's growing pains. So then you keep kind of pushing through it, and she hit a vaulting board once and that popped completely off. So they can be very bad. Growing injuries or growing pains can be an actual real problem. So are they something you have to be like, oh my gosh, we can't do any activities or sports? No, not at all. But they do need to be something that it's like, okay, but we also have to appropriately manage it and realize that I shouldn't just say like, yeah, your knee hurts, it's just because you're growing. Don't talk to me about it anymore. That wouldn't be the appropriate answer either. So, which probably is what someone said to you, is, yeah, you're just growing. So, yeah, for sure. Yeah, I think we know a lot more about rehab and strength training and how the body works now. So, all right. It didn't change. There it did. Okay. So, overuse injuries. So overuse is that can be like that Osgood-Slaughter, things like that, shin splints, stress fractures. Has anyone in here had a stress fracture? Yeah. So those are all, so 50% of injuries are overuse. And if you think of, it's called overuse, I don't know, we probably maybe didn't have to have that injury. So do we think we can prevent injuries? What do you think? Yes? Yes? Yeah. Oh, why are we here, right? Yes. Why else would we be here if we couldn't prevent injuries? So the answer is, sure, we can prevent lots of things. All injuries? Absolutely not. You're gonna have things that hurt sometimes. You're gonna have aches and pains. Some people are gonna break bones or have traumatic injuries, and that just happens. That's part of sport and being active. But there are a lot of things that we can prevent that I think a lot of times the desire to play the sport is greater than the desire to keep our body healthy. So sometimes we have to think like, but if my body was healthy and strong, would I be better at the sport? So you guys are like good for being here to learn those things. All right, so how do we prevent, oh wait, don't read it. How do you prevent pain and injury? Give me an idea. What's something you can do to prevent injuries?
You take medicine?
That would be like treating, yeah, not really preventing. Eat protein, eat, yeah, everything we talked about with Andy, right? Like your body can't repair and do things if you don't eat food. Hazel?
Seeing doctors that can help you figure out so you know what to prevent it.
Yeah, I think that's a great answer is knowing where you have weakness and where you can improve. I don't know that going to a medical doctor and just having them say, right? So I think a lot of times we put a lot of faith in this, like I'm gonna go to my doctor and my doctor said it's just growing pain, so I'm not gonna worry about it. Instead of maybe, I know people like Jenny who they could see where am I strong, where am I weak, how could I move better, what could I do better to help keep my body as resilient as possible, right? Any other things? Sleep. Oh my gosh, that's such a good one. We have a whole slide on it. Anything else?
Build your muscles.
Yep, being stronger. Yep. Stretch. Yeah, stretching is part of it. I think that where I'm at with stretching at this point is I think we overemphasize stretching and we underemphasize the importance of stability. So the ability of your body to be flexible. So flexibility is your body's ability to relax through the muscle's full range of motion. If your brain, so your brain controls everything in your body, doesn't feel safe enough to allow a muscle to relax all the way, then it will be tight, right? So if I just continuously stretch something, but I never build stability or let my brain feel like, wow, I'm so stable, my hamstring doesn't have to be tight, I'm probably never gonna have a more flexible hamstring. Does that make sense? Stretching doesn't make your muscle longer. Stretching should, if you're doing it right, allow your muscle to elongate through its full potential. It's kind of a hard concept. So, all right, we'll go through some of them. Eat. Andy talked all about it. We're not gonna talk about it anymore. You guys all know all of the rules. We're gonna listen to our body when it tells you something. That's all pain is. Pain does not mean I'm really injured. Pain does not mean I'm gonna be super hurt. Pain does not mean I'm gonna be in a cast. I mean, it might mean some of those things, but pain simply is like an alarm clock. It's like, hey, pay attention, something doesn't feel good, you need to listen to me. And so you actually should listen to that. Does that mean you have to stop everything you're doing and be super worried and run to the doctor? Absolutely not. But we will talk about what you do when that happens. But I will say it is important you listen a little bit. You wanna know, you wanna listen to what your body's telling you. Manage your stress. What's stress?
Homework.
Homework.
Boyfriend.
Friend problems. What?
Like a certain essay that you're really
Yeah, you have a project or an essay you have to do. You have a fight with a friend. Someone didn't invite you somewhere. You're nervous. You have the spelling bee. Parents? Oh my gosh, parents are a huge one. Your coach was upset. You didn't get invited somewhere. I mean, there's a lot of stress that happens. Oh, moving? Oh my goodness. Parents? Maybe parents getting a divorce or someone in your family being sick. There's a lot of stresses we can go through, okay? So that's important to manage that. Getting enough sleep. Yep, we'll talk about that. Keep up with your strength training. A lot of times we get into our season, whatever our competitive season is, we're like, we're only practicing our sport. We don't care about being strong anymore, which is so silly, right? You're gonna get into your sport. You're gonna build all this strength in the off season. You're gonna go compete. What part of your season is usually the most important? The end. How long does it take to start losing strength? A couple weeks, 2 weeks, 2-3 weeks. So I'm gonna work really hard and get strong. I'm gonna compete in my sport for like 3-4 months. But I'm not gonna do any strength training that whole time, so by the end, I'm gonna be my weakest, right? So that's an important thing to think about, is maintaining strength is really important, and then have a prehab plan that you actually do. So there's a lot of people that are like, oh yeah, I have exercises I can do, but they don't do them because it's boring. And I have no problem in saying it is boring, especially you guys, all of your ages. You are like, I do not wanna do these boring, stupid exercises. And it's really, it really does take normally until kids are like 16 or 17 to feel like they want to be really diligent about doing the boring little things. And some adults don't want to do the boring little things. But it is truly amazing how much better you will be at your sport. If you don't care about getting hurt or whatever, then just don't ignore that part. But having a strong, stable body will make you better at your sport. So if you care about being good at it, then doing prehab is helpful. And we'll talk about what prehab really is. Okay, so sleep. So you can find how old you are on here, and it can show you how much you need to sleep. Okay? And if you're under whatever that is, the study really didn't look at kids that young, but the study was if you don't get your recommended sleep, then you're almost 2 times as likely to be hurt, right? So if I go to sleep and I get my 8 hours, right? But Addie, how old are you? 11. So how much sleep do you need? 9 to 11 hours. So let's say Addie gets 8 hours also. She is twice as likely to be hurt compared to me just because of her sleep. So that's important to think about. Why does that matter? What happens during sleep? You can read it off the slide. So your human growth hormone is released while you sleep. That repairs muscle. It helps bones grow. You guys are all growing. So that's why when you're this age, when you're 6 to 13, you're in big growing years, you need more sleep because that is when you grow, right? So I ate all my food during the day, I did all my work, and now I'm gonna go to sleep so my bones and muscles can grow. Make sense? Same thing for you adults, important. So best things you can do to get a good amount of sleep is just go to bed at the same time and get up at the same time every day and have a really good sleep environment for you, somewhere you feel like safe and cozy and not play around on your phone. I'm a little guilty of that from time to time, but yeah?
What if you don't get to go to sleep the time that you need to go to sleep?
Yeah, I think that's really hard. You mean consistently? Like
you wake up, like you can't go to like if you went to a really night party or something. And
Well,
you didn't go to bed on the
so this is really on an average, right? So we kind of want to look at our life in general. So not just one night. It's not like, oh my gosh, I only got 4 hours of sleep last night. Now I'm going to get hurt the next day. It doesn't really work that way. It's more like, wow, I played this video game and then I watched a movie and then I was up talking to my friend. Does anyone talk to their friend on the phone at night? Who does that anymore? No one. Ridiculous. Texting, Snapchatting, FaceTiming, but you're doing those things. And if you do that over and over and you just can't get to sleep, but then you have to get up early, things like that. I think for parents, a lot of times there's that little bit of, oh my gosh, this is my time that I can have for myself. And so I want to stay up and I want to watch a TV show or I want to do whatever, but then I'm also going to have to get up early because I want time in the morning before this kid gets up. So now I've really shortened my sleep window for that too. So I think it's, starting to think about that. Where can I change things to try to get that consistency? It can be really hard for kids, especially as you guys get a little bit older into your teen years. It can be super hard if you have a sports practice and you have a lot of homework, because you also need time to just do nothing. You need time to chill out. And so I think that gets really hard for teenagers who still need this decent amount of sleep, but now and that's something, some of you guys are teenagers, some of you aren't quite teenagers yet. And so that's something to think about is, so what do we do about that? Like, where can we give them a break? Like, are they doing well in school and we can fudge some school days occasionally? Can they go a little late? And I'm not saying that, don't say Jenny said I should go to school late, but I do think that's something parents can think about a little bit is, what am I doing that if I think you have to be up at this time and you have to be at school and you have to do really well and then you're good at practice and you're gonna do this, you're gonna eat dinner, you're gonna do your homework, and then suddenly they're sleeping 6 hours at night because you have all these expectations of them, you're just asking for something bad to happen. So really looking at and I get it, some sports you have to put that time in, so where does that go? There has to be something that can give a little bit to keep you sane and healthy, right? All right, also when you get that amount of sleep, you have better immune system, so you don't get sick as much, you're in a better mood, and then you can also have better concentration, which reduces risk of injury. All right, so stress. We talked about all the things that are stressful. So there's also research studies that show that if you have psychological stresses, so all those things we talked about. You got in a fight with a friend, your parents are annoying, you have a lot of homework, practice was bad, all that stuff. If you're having all that going on, you also aren't able, not physically, so your body isn't able to really get the benefits of the work you did. You can't gain strength if you're constantly under psychological stress. So it's important, and I think that's something that lots of people are doing better about, right? Is talking about athletes' mental health and things like that. I think people are talking about it a lot, but it's what can we do about that, right? One, figure out what your stressors are. What is a stressor? This stresses me out. And if you feel like you can't say something stressful, that's a stressor because now you're just holding it in, right? So I'm really nervous about this test. I don't feel like I slept enough. It doesn't mean the stress just goes away, but it does feel a little better if you let it out. So sharing it with someone, writing it down, journaling, right? Those are all things you want to come up with a plan also. So competitive stressors are things that happen in your sport, right? So I'm nervous competing, I'm really nervous about the game, things like that, coming up with a plan. So when I start, I felt competitive stress. I was a little cuckoo, my brain really went crazy when I competed, my whole life. And so I really had to try to come up with strategies, what am I gonna tell myself when this happens? How am I gonna handle it? What kind of things am I gonna say? What's my body language gonna be? And that, having a plan, helps. It doesn't mean you're not gonna have to keep working on your plan for your whole life, but just not trying to have a plan is way more stressful. So use your voice, speak up. If something isn't right, you're not happy with your coach, someone hurt your feelings, you should be able to stand up for yourself and talk about that. And that can get really hard. So it takes practice, right? Little things. And you can always say it. Whenever you use your voice, it's the best thing to do is talk about it from your point of view. My feelings are really hurt. Instead of being you said this to me and you did this, being I really feel like I'm working as hard as I can. I'm just not improving and I'm feeling so frustrated. That is a better thing to say than you keep saying I'm not working hard and you're not giving me my playing time, right? So think about, how do I feel? How can I express how I feel and share it with the people that it is important to, okay? And then make sure you're watering all parts of your life. So you can't just only care about one thing. You gotta have friends and do stuff with family and watch movies and, yes?
Did you see that video of Cristiano Ronaldo?
No.
So he's lining up for a penalty kick towards the end of the game, and he's speaking positive affirmations to himself, and they're really I don't know. So you can read his lips, and they voice it over, and I just think that's so it's such a cool clip because he's the most successful athlete of all time, and by every measure, and you get to this point where he's put in this situation, and you can tell he's still stressed out, and he's got all these positive affirmations that he tells himself out loud, verbally, in the moment, and they catch him on camera. It's just a really cool moment, kind of speaking to this.
They showed a lot of that. You could see it. So obviously we talked about how I've been involved in gymnastics forever, but like Simone Biles and Suni Lee, a lot of them, like Suni always puts her hand on her stomach and you can see what she's saying. And just getting in the habit of that right now, like take a little Post-it and write a little something good about yourself and stick it on your mirror. Like little things, like how you talk to yourself is really important. You talk to yourself more than anyone else does. So you got to figure out what you're saying in there. And sometimes putting that in front of your face is important too, because that can get really hard. So everyone can think of something nice they want to tell themselves. And I'm going to make you all write it down before we leave. Just kidding, I probably won't. Okay, so keeping your body healthy. We already talked about don't ignore pain. Just don't ignore it. It doesn't mean you have to stop doing everything. Just you want to at least say, this is bothering me. And then always let someone know when something's hurting, right? I left practice. I do think you should tell your coach. It's not always the easiest, but hey, I'm just letting you know, like, I don't think I need to stop anything, but I want to let you know my knee's hurting a little bit. And then you leave and you go and you tell your parents, hey, my knee's hurting a little bit. And they'll be like, okay, well, what do we need to do about it? And you can be like, you're going to have a little bit of a plan because you came today, but I don't think it's that bad, but I wanted to make sure you knew. And that's a fine answer, right? What can't happen is you don't tell your coach, you don't tell your parent, you keep playing, you sneak some ice, or you just say, oh, this is bothering me a little bit, and you get some medicine, and you do that for weeks and weeks, and now it becomes a really big problem, and now we're really hurt, and we have to miss a lot of time. If you just address it early, there's a much better chance that it won't be a big problem, okay? Soreness versus pain. Soreness typically is in muscles, right? And you have a reason for it. I did this. Pain can be in muscles, but I would say pain is something that does not get better if you keep moving. It probably gets worse if you keep moving. And it's limiting how you're moving. It's not just like, oh, I did a whole bunch of squats today, so my legs are sore. It's like, man, I don't know what I did. Like, hurts to go up and down the stairs, hurts to squat, hurts to get in and out of bed, things like that, right? So there is a difference. You can have, your muscles are sore when you use them a lot, and that doesn't mean you're hurt. But pain is kind of a different feeling. It's a very like, you sometimes don't have an answer for it. Sometimes you have an answer. I got kicked or something, but that doesn't mean you ignore it. Knowing what your problem areas are. So we kind of talked about that, right? Having an assessment, figure out like, oh my gosh, I have the weakest side butt in the history of the world. And that is a common area. We will talk about that. Keeping up with your injury prevention and rehab. So having a handful of exercises that address where your individual weaknesses are. And then continue with your strength training, because we talked about that. Being stronger helps keep you healthier. So what do I do if something hurts? Like I said, you tell someone. You can always see, can I lessen the pain by doing something better? Maybe I wasn't moving very well, right? Hey, coach, could you watch this? This is hurting my knee a little. Does it look like I'm doing it okay? Something you could do. You could also limit resistance, limit intensity. Hey, it really hurts when I sprint. Like I think I could practice some like set plays or some corner kicks, but I don't know if I can keep running a lot. Things like that, okay? And then you get some help. Now, this is the hard part. It's really common to be like, hey, we're gonna run to the doctor. And I'm not saying that's bad. There's a lot of really great doctors out there that would just be like, hey, this isn't problematic. But if they say, oh, this isn't problematic, it's just growing pains, and they send you on your way and you're still in a ton of pain and you're limping around, that's not the right answer. So I would say get help from someone. It doesn't have to be me, but someone like me, right? That really looks at how do you move, what do you do, where are you weak, gives you some advice on what to do with playing, because it's hard to figure out on your own, and it's hard for your parents to figure out. Super common, like I said, throw ice on it, which ice in general, I'm not gonna say it's bad, but I think we overuse ice. There's a lot of research now that goes into when you ice something, it's not really physiologically doing to your body what you think, right? Inflammation is important. You need inflammation to help heal an area, and if we just are constantly focused on removing the inflammation, you're not gonna get good true healing. Medication's also extremely overused, right? Like, oh my gosh, this hurts, I'm gonna take something. There are studies that are done on rats, but that taking ibuprofen hurts tendon healing. So I'm taking something, if it's a tendon problem, I'm taking something because I want it to make me feel better, but it's actually hurting the healing. So like when I had my big shoulder surgery, this was the first time I'd ever heard it. The doctor was like, okay, you can take some Tylenol and you can take the medicine prescribed, but no Advil. Because like people will take it for a long time and it will actually slow the healing. So that's just something to think about. I have no problem, right? If I said to you, oh my gosh, we're trying to get over the hump, we're gonna do 3 days or 4 days of consistent ibuprofen. I'm not saying that's, oh my gosh, you can't do that. But I mean, I have kids that I've worked with that they've probably taken ibuprofen before and after practice every day for a year. And like at that point, like what are you doing? Like it's not good for your gut. You likely have damaged either organs, but also maybe that tendon isn't as healthy when there's a lot of other ways to handle it. Does that make sense? Yes? Okay, so getting help isn't just icing it and taking medicine. And then I'll also say, I didn't put it on the slide, but my rule's always for like, when should you get attention or when should you stop doing something? If you can't perform movement normally, you shouldn't be doing it. If I have to limp, I can't run as fast, I'm using one side more than the other, I'm trying to not move a body part, you shouldn't be doing it. You're just risking worse injury. Okay, so these are our common areas of weakness. So this is what we're gonna do. We're gonna talk about where this is, and then we're gonna come up with an exercise that we can all do to work on it. For you to keep forever, to go home and do exercises with for the rest of your life. Share with your parents. Sorry, Hazel. Ever. Uh-oh, I'm gonna have to make another one. Andy, would you go in there, you know where the scissors are, right? And cut a couple more red ones. All right, so what we're gonna do is, you can have this for right now, he'll cut one. Okay, so what we're gonna do is, where are our hip abductors? Who knows? Who knows where our hip abductors are? Does anyone know? That's your side butt, right here. Okay, this group of muscles. These muscles are important because they help stabilize your pelvis, which is important for your back. It helps your knee. If I can't keep out like this, my knee is gonna go in. This is the number one way people tear their ACL, is by either letting their knee go in or doing things on a straight leg. And if we're weak here and my hip goes out, my ankle is more likely to roll. So I'm more likely to have a sprained ankle, an ACL tear, and a back injury if I have a weak side butt. Okay? Here you go, girl. Oh, you're like, I wanted the pink one. I get it. The pink is very cool. All right, so what we'll do is we'll go through a couple exercises and then we'll break up and try them. Sound good? Okay, so that's here. Our deep core transverse abdominis. Oh my gosh, this is a hard one to figure out how to use. Okay, so everyone's gonna put their hands right here. Okay, and you're gonna go, ha! Ha! A little higher, put them right there. Do you feel that muscle popping into your fingers? Ha! Ha! Annie, let me hear you! No hitting your sister. Okay.
Let's hear it.
No. Okay, so did everyone feel that move a little bit? Now, can I make that happen without making the noise?
Yeah.
There's no noise. Okay, so that's the only exercise I'm giving for that today. Okay, is can I make my side abs, we'll call it our side abs work, without making a noise or crunching? A lot of times we do a lot of ab work that's like this, but that isn't really good core stability. Got it? And then hamstrings. Ugh, weak hamstrings all over the place. Where are our hamstrings? Up here, back of the leg, okay? Big muscle. So what we care about with our hamstrings is that weak hamstrings leads to Achilles problems and heel problems, because if this isn't strong enough, this is gonna have some trouble, okay? That has to work harder. If we have weak hamstrings, we're also more likely to have knee injuries, hip injuries, and low back injuries, okay? So let's go through 2 exercises with this band. We're gonna work on our hip abductors, or what did I say it could be called? Your side butt, right? And our hamstrings, okay? So I'll show them to you, and then we can take a couple minutes and try them. Sound good? All right, so we're gonna put this on our feet. We're gonna keep it around the arches of our feet. Now, the nice thing about this is you can practice keeping your transverse abdominis contracted while you're doing these exercises. So it's like a little more bang for your buck. So I'm gonna, ha! Even though I know how to do it without making that noise, it's a little more fun. So I'm gonna keep tension right here, and I'm gonna step. And my rules are when I'm stepping is I'm not allowed to move my shoulders. I'm not allowed to let my knee go in. I'm really not allowed to let my back arch. This is a really common one for people. So we gotta keep it down because this is nice and tight, and I'm not allowed to drag my foot. Do you understand the rules? So we're gonna, I'm so strong, guys. I am so strong.
Good to be strong.
Yep, exactly, see? She's listening. So we're stepping, we're stepping, we're stepping. Then for our hamstrings help our knee bend and our hip extend, which is going backwards. I'm gonna put it around one heel. So I'm standing out on one foot, it's behind my heel. My knees have to stay in line. And then I'm gonna curl. So this is also good because I'm working my hamstring, working my core, and I'm working a little bit of balance on one side. Okay? So why don't we spread out and try a couple of those? Spread out. Try the side steps. Yep. We're gonna do some side steps. Good. Ah, where's your toe going? Why is it pointing out? Cheater, cheater. There you go. Toes stay forward. Toes stay forward. Why don't you turn this way? That'll make you not run into shirts. There you go. Keep those toes forward. Bend your knees a little. Keep this tight. Good. Don't drag your foot, Annie. Don't drag it. Good. Good. Don't let that toe turn out. Good. Keep your toes pointed. If you got like little laser beams right here on that toe, keep it forward. Don't get Andy or your brother, even though you might want to get your brother.
Yeah, I caught him, Jen. I knew I was.
That's right. You can go around and you can poke sides.
He wasn't ready.
Yeah, he's like, I'm just gonna sit here with my bad posture and not do. It's hard. Remember, it doesn't have to be a big step. You just can't turn your toe out. Turning your toe out means you're trying to cheat. You're trying to use the stronger front of your hip. Okay, let's try the hamstrings. You guys get to take these bands home. So, yep. So put it around the back of one heel, the back of your ankle, under the other foot, and then hamstring curl. Yep, just like that, Annie. Perfect.
Twice, Jenny. He is a culprit for you.
You know what? First of all, Jeffrey, you should know that because you've come to me. Second of all, those boys are just going to toss you to the mat without a good stable core. I'm going to tell Huggy to just take you down. Good. You feel that hamstring working? Yeah. You feel it working? This is a hard one. You feel it? Good. Yeah. Yeah. Yeah.
I feel like they might not be great for our stability.
Yeah, I mean, there's probably a component of that. I think that, I am probably somewhat of a bad PT in the realm that I don't get on people about footwear choices unless they are injured. I do like, good to think about maybe wearing some toe spacers, good to think about being barefoot at home, working on some exercises so we know we have good stability, but I'm probably not super anti-croc. It's not an awful shoe. It has a good wide toe base. It has an arch.
Yeah.
Yep. So, yeah.
Good, as long
Yep.
as they're not injured.
Yep. But it's your butt. That's like the biggest muscle in your body, right? You want that thing to be strong. That's where you get your power. You gotta be nice and strong there. Unfortunately, so many people don't like to use their hamstrings. They don't like to use their butt. They don't like to use their butt. They like to use their calves and they like to use their back. So then they have Achilles problems. They have back problems. A lot of times those go hand in hand. So we need to figure out, how can I use my booty? Got it? One great thing you could do, you're sitting right here, no one's gonna even know you're exercising. You could practice, can I squeeze one butt cheek at a time? It's hard to do. It's hard to do in sitting. Yeah, not with your hand. Well, sometimes your hand can help it a little, is it working? So that's something you could do for it. It's just a little butt cheek squeeze. Easiest to do if you're laying on your back. Harder if you're laying on your stomach. Even harder if you're sitting. Okay? But that means if you can sit and just squeeze one butt cheek, that means your brain talks to your butt really well. Right? And a part of muscles being strong and working well is the connection between your brain and that muscle. Okay? Make sense? Yes? I will give you another butt exercise in a moment. We're also going to talk about ankle motion. So a lot of times we get really tight ankles. We aren't able to bring our knee over our toe very far. And if I am not able to do that, I'm not going to jump very well, and I land, my knees might come in, and then I'm at more risk for that. So having good ankle motion is really important for knee problems and low back problems, okay? So we're gonna talk about, you wanna do 2 exercises again, right? So let's do glutes and ankle. How about that, okay? So for our glutes, we get to use our band again. We're gonna try to use our band for all of our exercises, so you can just keep your little loop with you and get all your good exercises in. So we're gonna go here. I like to keep them on my arch. Some people like to put it around their ankle, so that's completely up to you. We are gonna try to, guess what? Keep that core engaged, and I'm gonna reach backwards, thinking about squeezing my butt cheek at the end. Got it? Okay? Then for my ankle, I am gonna put this around my ankle. Nope, we're not gonna use the band for the ankle. I don't like that. And we're gonna just work on doing this. So see how far I'm bringing my knee now. When I do this, what I can't do is this. Ooh, I moved a lot further, but where did my knee go? In, and that's super bad for lots of parts of my body, okay? So we're gonna work on here and just doing these teeny little bounces Well, we're keeping our belly tight to see if we can feel a little stretch in our calf, okay? If you feel it in the front of your ankle, you shouldn't do it. And then if you feel it in the front of your ankle, that's probably something we should talk about. Okay, let's try those. So kickbacks and the motion. It's not a specific muscle. I guess they're all kind of motions, but well, no, hamstrings aren't. Shoulder external rotation is turning our shoulders out, okay? It's really important for a lot of things. If we're gonna swim, it's important. If we're gonna do gymnastics, if we're gonna cheer, if we're gonna tumble, if we're gonna play basketball, if we're gonna swing a bat, if we're gonna throw, if we're gonna weight lift overhead, if we're gonna do jiu-jitsu, right? It's really important that our shoulders have good strength and external rotation. Hazel, are you snapping your band? Okay, so external rotation. And if we don't have good external rotation, then we have more chance that we're gonna have shoulder injuries, okay? So you have to have good motion and good strength of our external rotators. This becomes even more important for you adults sitting here because we all sit around, well, all of us sit around from time to time like this. We all do it, right? But if we do this and this is how we work and we drive and we're on our phone and we're watching TV and we're holding a baby and we're doing all that stuff and then we try to go do all these active things, that's why we get a lot of shoulder problems is we spend so much time in this closed position, our muscles aren't really used to working like this. So we have shoulder external rotation and then we have our scapular muscles. What are scapular muscles?
Big chicken wings.
Right? They're just the muscles that attach. Your scapulas are your shoulder blades. Does everyone know where their shoulder blades are? Yep, right here. Right here. There's two of them, hopefully. They're the muscles that attach to your shoulder blades. There's a whole bunch of them. We're not going to talk about a specific one. But if those aren't nice and strong and stable, then you're more likely to have shoulder, elbow, wrist problems. Okay? So the exercises we're going to go through for that are, here, this is going to be a really hard band for me to do this with. You're going to twist apart, pause, and come back. And you know what you also care about is not doing this with your wrists. So it's really common for people to try to get more motion by using their hands, and that's cheating. No cheating, okay? So we're gonna twist apart, and then we're gonna hold it up like this, and we're gonna press above our head. And my band's really tight, so it's hard to do, okay? Elbows, when you do this one, you can sit or stand, but your elbows have to stay touching your sides. You guys are all doing this. So no elbows leaving your side. And then the other one is like this. You're trying to keep your elbows right in line with your hands. Yep, and then bring them down. And then bend them, and keep the tension, and then press them up. Why don't you sit with like good posture to do it? There we go, perfect. Good. Yep, keep those elbows right on your sides. Pull your elbows in a little bit more, and then twist them. Good, it's hard to do, isn't it? Yeah. Trade with your brother real quick, just see, so he can feel a bigger band. He got a teeny tiny band. That's the first band I made today, I think. And it's real hard to use. Good. Yep, elbows right in and twist. And put a little, keep that tension. So just keep the tension the whole time, Annie. So you're never letting it get loose. And then come down, like this. Come down, and then press up. And then come down, like that. And we don't want to let our back arch when that happens. Also super common to make that happen. And your back arching can't make your shoulders externally rotate. Make sense? All right. Who has questions about any of that? Anything?